Carotid Doppler assessment of extracranial cerebral circulation. The carotid ultrasound is performed when we have one of these 11 indications, which includes the transient ischemic attack, hemorrhages fugax, carotid bruit, stroke, preoperative in patients undergoing surgery for PAD, CAD, aneurysms, other vascular diseases. We also perform it as follow-up of known stenosis, post-intervention follow-up, vertebral symptoms, asymptomatic blood pressure, pulsatile neck masses, and trauma. Sometimes the trauma can result in aortic dissection, etc. In carotid system, we have got two arteries, right and left, two vertebral arteries, two carotid arteries. The carotid arteries are right and left, the vertebral arteries are right and left. These are the vertebral arteries, and here is the common carotid from which we are getting the external carotid and internal carotid. Internal carotids are branchless, they have low resistance, whereas external carotid have resistance and they have branches. From arch of aorta, there are three major branches: the innominate artery, brachiocephalic artery, which has got the right subclavian branch and right common carotid artery. Left common carotid artery also have branches, so there are number of branches from left and right common carotids. The main branches are from the common carotid are external and internal. Then is the subclavian artery. The common carotid artery bifurcation at the upper border of larynx. This is the larynx here. Vertebral column more reliable, fourth cerebral vertebra. There will be right bifurcation, left bifurcation. On right side, the bifurcation is at the level of C3, and on the left side, the bifurcation is at the level of C4, at the cervical vertebrae level. The branches are the external carotid artery and internal carotid artery. Here you can see the bulb, the longitudinal section grayscale. This is the wall. Common carotid artery having bulb and divided into external carotid artery and internal carotid artery. Here we have the internal jugular vein, ICA, ECA after bifurcation in the cut section with colored Doppler. The external carotid artery has got 8 branches, 3 interior, superior thyroid, lingual artery, facial artery. These are the superior thyroid, lingual and facial. Posterior are the occipital and posterior auricle. Medial branches are the ascending pharyngeal. This is the ascending pharyngeal. Terminal branches are maxillary artery and superficial temporal artery. These are two terminal branches. Internal carotid artery, no cervical branch. Intracranial branches are the ophthalmic artery, middle cerebral artery, anterior cerebral artery, and posterior communicating artery. These are that branches. The posterior communicating, middle cerebral artery, and anterior cerebral artery. This is the ophthalmic artery, which has further two branches, the supratrochlear and supraorbital arteries. Then comes the vertebral arteries.